What is the biggest mistake, in your opinion, that healthcare vendors make in their whiteboarding phase that needs to be corrected at a time when it may be too late?
I
I
can
think
I
I
can
can.
take this. Oh, okay. Go ahead, Gary.
Sorry,
Okay.
Justin. Yeah, I think for me, and going back to where really began this discussion, which is about not focusing on our bells and whistles and our features and prices, is just having the right people in the room for that initial discussion. From my company, technology is always part of the solution. And if we don't have our clients' tech folks bought into this solution, then it's almost like we're erasing all of that value, because without that buy-in, there is no solution. So I think when we meet with our clients in the very beginning, defining who should be part of the, I guess, discovery process is really the key for us to almost like avoiding going too far before we can make adjustments. So for me, it's more about just bringing the right people in the room, especially when it comes to technology, because without that, I guess, connectivity or integration points, it just none of the solutions can really be bought into.
Hmm. I was
Any
going to
other
say,
thoughts?
yeah, I was going to say something similar. I mean, your response is far more intellectual and than what I was going to say. But I think what I see all the time from working with a lot of startups is a solution or an improved method of healthcare delivery has come up during the whiteboard phasing, but it's completely non-compliant where they want to sell it. For example, they come up with this new way of delivering healthcare billing or this new way of healthcare delivery. But most states, this is going to be redefining the Medicaid or Medicare benefit. It just doesn't work. It's a solution that in a perfect world, if there was no regulations, this would work. But otherwise, it's fully non-compliant and not able to sell. So I think the biggest mistake is people don't understand the regulatory environment, that who their clients are or what their client or potential prospects are beholden to, and they come up with a solution that's just going to put their prospects out of compliance if they continue to purchase this product or this service.
Says.
Hey, Justin, if I could use your comments as kind of a springboard. Number one, I think one of the major mistakes we make is we look at the managed care industry as a generic set of different organizations. And in most of our experience, if you've seen one managed care plan, you've seen one managed care plan. Each of them do things differently, although there is a compliance underpinning there. Many of them go beyond what the compliance requirements are, and in some cases, many of them even listen to what their customers are telling them. So before you get to see that customer, you should do as much prep work and learn as much as you can about that client and the struggles they have. And most of that information is public. We've talked about star scores over and over and over again. Before you go out to any client, you should pull out their star scores. You should pull out their health plan report card. You should look at all of that to make you as smart about what their pain points are when you walk out there. The second mistake, I believe, is that we have a tendency of oversimplifying the solution. We look at a problem like this, we provide them with a solution like this, and we don't speak to all the implications and interdependencies of what we're suggesting as a solution. So we need to think that through. And in my experience, and I've had this with a number of my clients, oftentimes they don't draw any distinction between a Medicare plan and a Medicaid plan. They think, well, they're all the same. It's all government. And I don't have to tell any of you how many variations on a theme there are. we start off at the top with a Medicare Advantage plan, but is it a PPO, a POS? Is it a closed network, an open network? Is it a SNP? Is it an ICE? Every one of those variations have a different theme and a different look, feel, and requirement. And it behooves each of you, before you go out to the client, to have that discussion with them, to understand what those variations are and what it means on a day-to-day basis to those people. The last thing I'm going to leave you with is ultimately the end user of your solution. Justin, with all due respect about compliance, you're right. Most plans will stay compliant and implement performance improvements to be compliant, period. And they forget that at the end of the day, there is a human being that's using that solution. What value does that human being derive from that solution over and above the compliance component to this? I'm going to stop.
No, absolutely. But at the end of the day, especially in Medicaid, you can't change the benefit package.
Nope.
And you can't change the way it's delivered. I mean, I worked in Medicaid for about 20 years. We would love to go over and above and give a benefit to a member that our competitors are not doing, because this is a member and this is our consumer and we care about our consumer. But at the same time, we're just not allowed, because the Medicaid benefit is a regulatory benefit that cannot be altered.
You're right.